Now, do you ever treat people with osteonecrosis, or is that like a contraindication to go to a chiropractor if you already have a bone that's like really bad, or does your treatment like improve the circulation and really help it a lot? So I don't know which way that goes.
I don't know if I've ever had anybody come to me specifically and said, I have osteonecrosis. I mean, I have osteoporosis patients, but I've never, I'm trying to think now if I've had one, you know what? No, there's one guy and he had it in his hip. I'm just trying to remember back. Like, it's not a real common.
No, it's not, because I saw someone with it today, and like not as a patient, but just a friend of mine is like, oh, I can't eat on one side of my mouth because I have osteonecrosis of the jaw, and she'd been on bisphosphonate. So that's something you hear about, but you're not going to meet a lot of people with it. It's like somebody saying they got struck by lightning. Like, it can happen, but you're not going to meet a lot of people that actually had it happen. It's very uncommon. So that's why I was like, oh, I didn't know if you. And then she's like, I'm going to all these doctors to treat it. And I'm like, yeah, there's not like a drug for it. It's not common enough to have a drug for it. You can cause it, but you can't cure it. You went out?
To get on the phone with you.
Okay.
And I pushed snooze instead of off. No, anyways, it was interesting because he had it in his hips, and I want to say he was maybe late 20s, early 30s.
Wow, that's young.
No idea what was causing it. And he had a lot of, now he works offshore. So that's something else. I haven't seen him in a while. Now that I think about it, I haven't seen him since he came in last summer. And I haven't seen him. Actually, it's been over a year now that I think about it. But it seems like when I would do some traction, and we'd do muscle work, because he would get really tight, and we would do muscle work, and I would do some traction, and and I would definitely, I adjusted him, but I mean, of course, I use the activator as well, so that's proven safe to be used on osteoporotic patients, so I use that. But it seems like it would help. I mean, it would always help his range of motion, help his tightness and his pain, and he exercised. He took pretty good care of himself, and so it was interesting why he had it. Never could figure that out, like what it was, what the issue was. So anyways,
now that I think about it, like, I'm thinking that radio frequency, the minute you said the activator that you used, I'm like, you know what? Let me see if radio frequency and osteonecrosis, because it's just like something like people use radio frequency to tighten the collagen of their skin, right?
Mm-hmm.
And the bone is right under there. So if you had osteonecrosis of the jaw, if you had like a deep enough penetrating, I mean, the bone is actually mostly collagen. People think it's all kinds of other things, but it's actually mostly collagen. So if you had something stimulating that, you might actually like encourage some growth.
Yeah, and I never really did any. I don't
have a machine.
I mean,
yeah.
I've looked into lasers. I've looked into a lot of that type of thing. Never used it in my office. So I mean, I kind of wonder if that would even help a little. I don't know. I've never done any research. He has been the only person, now that I think about it, that I've ever had in my office in all these years that specifically had that issue. Isn't that interesting?
I know, it's rare. There's like barely 200,000 cases per year in the United States. That's not even like, like you go to a concert with that few people. I'm gonna say there's just not. It's not like a lot of people. So it's not like any one doctor is not going to have seen more than one case. And so that's why I was like, she's going to people. And so I was like, you know what? I bet I could come up with natural stuff that's very similar to what I would do for osteoporosis.
Yeah, no, there's definitely things that are more natural, and I think with fewer side effects than all that.
Well, especially since there's not actually a drug she can use, I'm like, there's not a drug.
Oh, for osteonecrosis, or
right for osteonecrosis, okay, like there's not a lot of drugs for it. There's no drugs for it. There's not really a good treatment. They might try to cut it out, or they might try something, but there's not like a thing that we know.
I think they were wanting him to do hip replacement at some point. So yeah, he's putting that off as long as he can because he was so young. And yeah, it was an interesting case because, and he's never been real consistent. He comes in and, once every 6 months or so, if that. So yeah, isn't that interesting though? I haven't thought about that in a long time. And every time I would tell him like, oh, let's order some blood work, let's do something, he's like, he's disappeared again. So
Yeah.
yeah.
That is weird. Because that's the other thing is like you could do surgery on them, but if you don't know why their bone is healing poorly, you know, you've got a poorly healing bone, then you're going to cut on it, then it's going to poorly heal again. So did you do anything? You actually have to always start at the beginning.
Right.
Like, why does this person do that? Out of all the people in the world, why did they do that?
Yeah, I don't know. That was what was always interesting to me with him. I couldn't figure it out. And again, he was never consistent enough for me to really delve into it too much. So
Right. And like I said, no one doctor is going to have enough patients to get like really good. Oh, like even if you fix one patient, then the next one would come in and they might actually respond to different stuff. One might be a diabetic, one might have hypertension, and there might be something about those two diseases that predispose them. And so you're going to treat them differently,
yep.
you know?
Right.
So it's like you really
So
have to just figure out, why are your bones weird?
So you have a new patient that recently, is that what you're saying?
Yeah, no, it was somebody I know personally, but she
Okay.
was like, oh, I probably need to come see you. And I'm like, yeah, because it's like the doctors are all going to come up with some way to get the bone out of you and think that's going to do something, but you're an untreated menopausal female, and that's part of your problem. Is like, once all those hormones aren't there telling the bones to grow, you just have bones that don't want to grow, and no matter what they do, you're not going to replace it with new bone because they never figured out why your bones got to. I mean, that's more severe than osteoporosis. That's like beyond that, you know.
Yeah.
So you kind of have to. So like I said, I didn't know if there was any chiropractic thing that,
that's a really, I would say they probably would say the real, traditional adjustments might be contraindicated depending on how necrotic the bone is, right? But that's why, I like the activator for cases like that. So
right, because that's why I figured it would stimulate, like not, radio frequency is one way to stimulate, but you also got manual stimulation. There's massage that can increase the blood flow, maybe a fascia blaster. I mean, there's like a lot of little ways to increase blood flow. And I actually have radio frequency at my house because I use it on my skin.
Oh, yeah.
Like it's good for cellulite, or even like red light. I mean, there's just so many things, so much energy you could put at an area and increase the blood flow, and it would take forever to grow. Not forever, but it would not be an immediate thing. You know what I mean? Like people like surgery because it's like, and then tomorrow we've done something, but bones don't grow overnight and they don't fix themselves overnight. Even osteoporosis would take me, it takes you 10 years before we even decide that you have it. Between normal and osteoporosis, that's a 10-year journey, and you will not repair it. Maybe you'll repair it in 3, 4, or 5 years, but it won't be like a month and like, it's done. No way.
Right. Very interesting though. So is it something they've known about, or is this a new?
It's new. I think it had to, once your jaw, I think something happened. She had pain and they went to the dentist, and then they eventually figured out, oh, this is osteonecrosis and she was on drugs that do that. But like I said, even when I don't prescribe those anymore, but even when I did, I was like, this isn't even like 1% of the people. It's not even 1 in 1,000. I mean, it's like very low that happens, but that's like one of the worst things that can happen if you get a bisphosphonate is that you will get osteonecrosis of the jaw or the hip. Then you can't, then walking becomes difficulty. But
no, I know that's why
if it's of the jaw, then eating becomes difficult. And I don't know that I haven't heard of the shoulder or the foot, but I guess it could happen in any joint. But yeah, the jaw and the hip are the most common that I hear of.
Yeah, he definitely had it in both hips. Yeah, it was just, I mean, it was one of those situations, and he had such a great attitude, I have to say, but man, it was,
because some of the things like family history, I don't know that it runs in families, but poor diet. He was a guy who knows physical inactivity. No, he worked on the oil rig, so that wasn't it. Smoking, because that limits your blood flow. Certain medications, steroids, and bisphosphonates are the two that I would see most commonly. Low body weight, probably not his problem. Overactive thyroid, parathyroid, yeah, that does everything. And adrenal fatigue. So that's why there's a thing about hormones. You want to make sure if they have thyroid that it's optimal, or something's wrong with their adrenal gland. You want them DHEAs over the counter. You can
Yeah, and again, he never was consistent enough to get in there, and for me to order blood work and really like delve into it. So, and that is an interesting challenge with some patients. Some are really great about, doing kind of what we recommend, and some, I don't know. It's
right. Plus,
always
it's a hard disease to follow up. It's not like, osteoporosis, I can scan you every year, but like I said, that's still only your insurance pays for you to get a bone density once a year. It's not like I can scan you every month and figure something out. And osteonecrosis, I don't even know what they see on film to even diagnose. I mean, you don't biopsy it. I mean, like, I gotta look that up. How do you diagnose it?
Yeah, it's definitely it's interesting. I haven't seen any, and now that I think of all the x-rays I've seen, I don't think I've ever seen anything pop up as like something
where you
they
would
didn't
know
already
that.
know about, right? So that's an interesting thing to think about too.
So that's the only thing. X-ray, it would look like late osteonecrosis. Yeah, you can X-ray it, you can CT scan it, MRI, bone scan, radioactive material. But otherwise, yeah, it's not like, I don't know how it looks different than osteoporosis. I guess only a radiologist who had seen it before would say, oh, that's it, because some of them aren't experienced enough to see that.
Yep. I know. That's why I'm really particular about which radiologists I use. I have to say, I have gotten some reports that I'm not very impressed with. So it's like, nope. I sent them to a couple people and that's it. So.
Yeah, or maybe I'm looking at a picture on the internet, and maybe the gums kind of erode, and then they can see that the bone is a weird color, and that's how they get it. Because otherwise, I'm like, how do you see that on X-ray? Yeah, it's pretty bad looking. It's like really bad cavities. Right, and they have X-rays of it, but I would never know. You read them more than I do, though, so you would know. It does happen to me.
I don't really read
never
that many. I always have the radiologist send me reports so I can, and I say they read 100 a day, if not more, and I don't know. I mean, as much as I was trained with doing that, I still absolutely rely on their information and their reports to go along with what I see, because I hate to take a chance on missing something.
I'm thinking collagen might have a role.
Oh, I'm sure. I'm sure there's a nutrition component to it, but I think too, there's something, because I remember he, like I said, he worked out. He seemed like he took care of himself, and was in good shape, ate pretty clean, didn't drink, didn't smoke, no drugs, and he, so I wonder if it was just something just oddly genetic, or something, there was something about the blood flow to that area that just was causing, those bones to not get the nutrients they needed to, they were just breaking down. It's interesting because he'd had it since he was a kid, and it just kept getting worse over the years. So anyways.
Oh, I found an article about hyperbaric oxygen therapy and osteonecrosis. So why do you want to get one? Like, what do you do that you would want it?
I just, just an addition, I guess. It's just great for the health in general. It's great for,
oh yeah, I didn't know if you read some
for so many reasons, not just for bones, but just in general. All the, I keep thinking about all the things that I keep wanting to get over the, and there's a couple of other docs that have gotten them in their office. I'm like, you know what, I should get these.
No, but that would be good, because that does treat like everything, especially post-COVID stuff. Oh my God, I already know like what people should do.
That,
is
and then
cool.
also, you know, the vibration plates. I thought that would be kind of cool. A lot
Yeah.
of this stuff, I think, what are the things I would want? Because that's probably the things other people would do as well.
Well, plus, if nobody ever wants to do it, you at least you've got it, and you're gonna stay alive. Man, I'd be right in that hyperbaric oxygen chamber.
Yep.
So,
So
mhm.
that was one of the things that I've been thinking about. So, anyways, it's kind of funny.
Yep,
Kind of funny.
hyperbaric oxygen. So that's one thing I found. So hyperbaric oxygen.
What about the vibration? I do wonder about that. You know, there's a lot of, you know, and I'm not really looking at research in front of me at this moment. I'm just thinking out loud. The vibration plates, like how much it stimulates the body in so many different ways, and then of course they've got different levels of vibration, and how much, you know, it can actually, it helps with bone density. There's so many different things. I thought that was kind of interesting. That might be something to think about too.
And then she said she's been on a million different types of antibiotics. And I'm like, antibiotics aren't going to penetrate
That's
that
not
dead bone, but an
good.
essential oil might. So I'm like, what oil would penetrate a dead
Yeah.
bone? Now that is something I got to figure out. No, nothing. Oregano, which one
interesting.
is good for
I could see
bones?
collagen. Yeah, I could see like doing some high doses of collagen to see if that would, you know, the question is, I mean, because it's more systemic, right? When you're in.
Yeah, if you don't have the blood flow, could you build the collagen? I mean,
Yeah.
I know hormones can get wherever they want. I was trying to think of like things that would get there no matter what, because hormones are always going to go and try to find something. Stem cells are going to, you know what I mean? Like I would do stem
Right.
cells. You know what I'm saying?
Yep.
Exosomes or something. Yep. Inflammation, mesenchymal stem cells, and bone regeneration. Yep. Stem cell therapy for osteonecrosis of the femoral head. Yep. I knew I would not have been the only crazy person to think of it, but this is 2020. This study just came out in 2020.
But now stem cells, there's so much controversy with those too, because are you getting the number of cells? I mean,
yeah, but
where
see,
they're sourcing it?
I save stem cells for things that you got no other thing. Like it's not like, well, will it work? Will it work? Okay, what else you got? Nothing. Okay. You know, so usually, I mean, if there's something else that's cheaper, that's easier, that will work, we're not even talking. By the time I'm going to use stem cells, I'm like, okay, we can use nothing.
True. Yeah.
So for this particular thing that has nothing, at least somebody has tried this and said, oh yeah, let's do it. So that's my thing about stem cells. It's
they're
like
open to doing things, right?
Yeah. It wouldn't be the first thing, but I would be like, hey, push comes to shove, it's going to accelerate whatever we're trying to do, because those things look for stuff to do. That's just what your body naturally, when you're young, you know, stem cells or PRP, which is much cheaper and easier.
Yeah.
I don't know. Let me see prolotherapy. Prolotherapy is when you just inject other stuff, like B vitamins.
Yeah, it just,
you know, like prolotherapy is so much easier to do than. Yep, here is somebody in 2019. Is prolotherapy effective in the treatment of avascular necrosis of the femoral head? Somebody already thought of it. I'm not coming up with crazy stuff. I'm coming up with things other people.
No. I mean, it all makes perfect sense to me. It's just a matter of, I guess the question is how much
will it work? Oh, we don't know. And I just tell people straight up, like,
it's not something that I'm doing. Is it something that I'm going to be doing, and who's doing it? I guess that's the question, I guess.
Or do you dry needle though? I know another chiropractor that dry needles, and so if prolotherapy will work, why wouldn't dry needling work? Because when you dry needle, yes, this is what I'm, just because, like, I can do I can do both. I mean, but I'm just saying, like, that is something I would totally do.
Yeah.
There we are trying, like I said, because you really have no other treatment, but at least it's not harmful. Would I hurt? The first question I always ask is, will I hurt you if I do dry needling? No. I mean, what can I do to you? Nothing. How can I hurt you if I inject B12 into your jaw? No, I cannot hurt you. I mean, you'll feel physical pain, but I can't do worse than what's happening, right?
Right.
And so in stem cells, same thing. It's like, it might not be effective. It might be tiny bit effective. Do I need to do it 10 times? I know none of those answers because who's done, not very many people have done it, but it's still like right now you literally have nothing to do. You don't have much in the way of treatment of this issue.
So is this somebody local or is it
Yeah,
someone?
yeah.
Okay.
It's somebody I know. And then she was like, I was like, why aren't you eating? And she goes, oh, I can only eat soft things because this side of my head. And I was like, oh, you had a wisdom tooth? And she's like, no, I have osteonecrosis of the jaw. And I'm like, what? You're like the only one. What's happening?
Now, is that, I wonder too, the necrosis in the bones, was it a cavity that just grew?
Well, she was on bisphosphonate. So it could be that she had a cavity and then on top of that you had a bisphosphonate and then there you go. I mean, I don't know if the bisphosphonate does it or the person already has something ready to blow. Maybe it was already a root canal thing and then she's not my patient, so I didn't ask her like 799 questions about her dental history, but she could have already had a root canal there, which already leaves a little dead bone anyway. Then you go on top of it with your osteoporosis. You're not on hormones. You don't take calcium. I don't know this about her. I'm just saying, give me, if you give me this person, I'll be like, oh, well, you had like 10 things going on and that was the straw that broke the camel's back. Now the bone is just given up. Now we have to resurrect it. Osteoporosis is difficult enough to try to troubleshoot without a drug, but then osteonecrosis you have the other disadvantages. It's not as common as osteoporosis. At least we know certain things work, whereas this is so rare. Like I can make up stuff. I can find some research studies of somebody who did one, but you won't find anyone who did 100 because
there's not enough.
There's only so many people walking on the planet with it.
Yep.
None of whom I know have been cured. It's like not like there's a lot of stories about, and then my friend did, apple cider vinegar and now we're done, so there's no thing I can say, let's try it. Yeah. So far all we've come up with hyperbaric oxygen, prolotherapy, and stem cells, which is actually a pretty good start because before we had nothing.
What about the vibration plates? Did you look that up?
I did, and I didn't find anything, but
really?
I found, like I said,
I don't know if there's another term.
No, I looked up radio frequency specifically and I didn't get anything like that popped out, but I'm like, theoretically that should work. Or ultrasonic therapy. Maybe I'll look up ultrasound because sometimes ultrasonic stuff works. So yeah, PRP, got to study on that. All this is 2019 and 2020. So I'm like, oh yeah, PRP. But I know there's an essential oil. I know it.
Well, any of the ones that you would use for osteoporosis? I mean, I don't think so.
That might just be what I have to do. And since I wrote a whole book about it, let me see.
I'm just thinking from that. I mean, I don't know.
Yeah, I have a book chapter on it.
I mean, it's not the same, but it's.
I mean, it's bone health. I mean,
right.
Yeah, you're never gonna find an essential oil in osteo. There's not enough people. It's one of those things. It's like, well, I can't get a thing about it because it's not enough people. Essential oils that specifically were studied as bone builders: clary, sage, eucalyptus, frankincense. Frankincense says everything. Like when in doubt, grab lavender or frankincense. It will do anything. Okay. Juniper, pine. Yeah, I knew that all the pine spruce ones would work because they're testosterone boosting. Rosemary, sage, and thyme. So the blends would be evergreen essence because it has all those pines and stuff. Sclerescence has sage and clary sage in it. So that's one I use all the time for menopause anyway.
Yeah, I like that one. Sclerescence. That was the one.
Yep.
That one smells really good too.
Yep.
I opened that the other day and
they have a new oil called Bloom. So if you run out of things to order, so they already have the Bloom.
I just got that.
The Bloom oil, not the Bloom facial stuff, but the Bloom.
Yeah, no, I did. came with a special little spray bottle. I got one.
Yes, yes, yes. So I got that. Yes, I love that.
I was like, wow, it's actually really nice.
It smells exactly like their Amorescence.
Oh, really?
If you've ever been to beauty school, they have this one blend you can only get at beauty school called Amorescence. And they only have
Okay.
four oils in common. Otherwise, I was like, if you made me smell both of them, I would never know which one was anything. Ningxia Red is supposed to be, polyphenols are really good for bones. So Ningxia Red would be good for bone health.
Well, I mean, I guess the question is, what is her nutrition like? Yeah, I'm assuming it's a female, right?
Yeah, and she's a
Um,
very thin, healthy looking. I mean, you know, some people you look at them and you're like, I know you must be eating wrong, but she looks like she has a reasonable diet. But like I said, if she's
mhm,
not supplementing, most people think their diet is good, and it might be, you know,
right.
they eat a salad and they eat, you know, all these, they eliminate a lot of junk. So they think, oh, I'm really healthy because I eat a lot of, don't eat any junk. But sometimes they're missing stuff. You know what I
They're
mean?
missing
It's hard to
stuff,
get,
right?
if you're not supplementing with magnesium, you're low. And I always tell people that, I'm
Yeah,
like, if you do not specifically take a supplement that has this in it, you do not get this from your diet. It is not possible. I have tried it. I track my diet. I put it in every day.
I
I
know.
will never in
That's
365 days get 100% of the RDA of magnesium. And I actually need double that.
well, and it's such a large molecule that you have to take, just to get 100% in capsules, you have to take 2 or 3.
Oh yeah,
It's not something, and that's why everybody assumes, oh, it's in my multivitamin.
I know.
And I'm,
Nope.
no, it's not.
So
Well, you might
that's,
have a small amount. You might have 2%
yeah.
of your allowance in your multivitamin, but
Yeah, and
yeah,
most people
it's
don't realize that if they don't have someone else calculating all this for it, they're gonna miss something. They're gonna read on the internet, oh, I should
mhm,
take calcium and vitamin D, so I do. And I'm like, oh, what about the magnesium? What about, did you take collagen? What about, did you take enough calcium? Did you take it the right way? Did you split it all up or did you take it all at once? Did you, I'm like,
right.
there's a million different things that you don't even think about. And even like
Yep.
fish oil, and if she's inflamed anywhere, then there you go. Do you eat gluten? Do you, do
See,
you
and
drink
that's,
milk?
yeah, there's so many things to look into with
Yeah.
something like that. So
Yeah, it's gonna
yeah,
be one of those things that's, even if she finds a doctor that gives her one good piece of advice for the osteonecrosis, it's one of those diseases that's gonna need 10 things. One thing is never gonna work.
mhm,
Surgery
yep.
is not alone is not gonna work.
Well,
Eating,
who is
I'm gonna
she? Is
eat
she
right,
working
not
with
gonna work.
somebody?
Huh?
What is she, or is this is a new diagnosis for her, I guess?
Yeah. First time she's told me
Ah,
about it. But and then
gotcha.
she's also, yeah, she's definitely menopausal. She's definitely not on hormones. That I know. And I don't think she's like a super, I take 20 pills a day person. And pretty much for
Right.
your bones, you're going to be, I take 20 pills worth a day person. There's no way you can do it
Yep.
without bone. You need a ton of vitamin C because vitamin C promotes collagen. If you're not doing that, then here's your bones. They need
Hmm.
collagen.
I know that's tough. That's a tough.
Yeah, there are a
That's
lot
a
of
tough
oils
one.
that help with circulation. You need them because circulation is, if you, in order to get osteoporosis, your circulation must be compromised in some place.
Right.
It's not, you do not have perfect, none of us do. As we get older, it usually gets worse, but
I do think, though, it seems that there's something that she's missing, I bet,
oh, probably a lot. I could probably come up with like
Yeah.
a list of lots of stuff. Oh, somebody came to visit us. Oh yeah, so yeah, in the osteoporosis protocol, I have regenolone and thyromin, like all the hormonal stuff,
Hmm.
because like without those hormones, you are, your recovery rate will be slower. Teas for bone density. Have you ever had anybody take like
Mm.
green tea and black tea? They definitely have osteoporosis studies. Just plain old green tea and black tea.
I love, I think green tea is fabulous for a
Yep.
lot of
For
things.
everything.
So,
I know. So yep.
mhm.
If if the person is a coffee drinker, which is not good for bones, I would have them use tea.
Yep. No, I do like my coffee, but I've gotten to where I'm drinking my mushroom coffee now.
Oh, see, and you like it?
It's like, how do I keep getting healthier and healthier versions of my not so great habits?
Ooh, let's see if I have, oops, mushroom. Let's see if mushrooms have anything to do with osteonecrosis.
Ganoderma and
Yep.
Ooh,
mushroom extracts decrease bone resorption and improve bone formation.
Interesting.
Things I find. Yep. International Journal of Medicinal Mushrooms. Oh, I didn't even know there was a journal called the International Journal of Medicinal Mushrooms.
Interesting.
But there is.
Very interesting.
But yes, there are mushrooms that can help with bone resorption and bone formation. So I'm gonna have to put that in my book.
Huh.
I don't think I have any mushrooms in the book.
Which book is this?
My Menopause Essentials. I have the PDF on my.
Are you updating it?
Yes, every time I see something new, I'm like, you know what? I did not write that.
Add that to it.
I'm about to add that. Mushrooms. So that would be, melatonin. So that would be MU-Pro. And what else has mushrooms? I think that's it. MU-Pro.
I know I've been doing this like Ganoderma coffee lately, so.
And it tastes just like regular coffee.
One a day. I mean, I've always just, I don't know, it's kind of a weird, it's something I quit every once in a while. I'll stop drinking it and then I'll go a couple months. I'm like, I just want a really good, nice warm cup of coffee. So it's like, how can I do that healthier? So I found a healthier way to do it.
Let me see. Melatonin. Melatonin helps with anything. If you look up melatonin in any disease, you will find something. And there is a study in 2019. Melatonin, another avenue for treating osteoporosis. But I knew that melatonin was good for your bones. I do not know why I knew that, but I did.
And I've also seen it's good for Alzheimer's.
Oh, because your brain, it helps your brain, but that's still, why does it help your bone? I haven't figured this out. Well, bone metabolism, it's a hormone and just, hormones. Yeah, but I was like, specifically, I mean, it does a lot of stuff for your brain. It does a lot of stuff for your gut. It lowers your cancer risk, but I'm like, okay, bone, I hadn't thought about it. I know about all the other hormones in bones, but I did not ever think about melatonin. Oh, yeah. The effect of melatonin on prevention of bisphosphonate-related osteonecrosis of the jaw, an animal study in rats.
Wow.
Yep, 2020. Journal of the Korean Association of Oral Maxillofacial Surgery. So anyway, yeah.
That's pretty recent too.
Yep. Melatonin induces human stem cells, converts pre-osteoblasts to mature osteoblasts, and reduces the duration of this transition. However, melatonin itself prevents activation of osteoclasts. Here we evaluate the role of melatonin in prevention of bisphosphonate-related osteonecrosis of the jaw. So should everybody who gets bisphosphonates get put on melatonin? I guess so. I put everybody on melatonin anyway. I'm like, oh, hi, welcome to menopause. Here's your melatonin. Because it's going to protect your brain, and your sleep usually decreases in quality, and it's got a lot of good data on just menopausal complaints in general. So I'm like, the minute I meet them, most of them can't sleep anyway. So here's melatonin. But the ones who can sleep, I'm like, it still has benefits. But we're preventing cancer. We're lowering inflammation. We're trying to induce repair. So they're on it anyway. So my patients wouldn't have a problem. They'd be on it for some other reason, but specifically, everybody should be doing this, but they do not know because this thing just came out in August of 2020. Yeah, it's pretty new, and it's kind of obscure. Who reads the Journal of Korean Association of Oral Maxillofacial Surgery? Nobody reads that. I don't read that journal. I just found it.
That's a very specific.
Yeah, that's the only one I found. Yeah, let me see if there's another one. That's the first study that popped. There's only 4 results.
Where are you looking right now? Are you
PubMed? I live in PubMed. I'm there every minute of every day. But okay, so here's one. 2013. There are many potential medical therapies for atraumatic osteonecrosis. Oh, really? Let me in rheumatology. Okay, that's actually a journal that people might read. In 2013, there are. Oh yes, here we go. Told you. Application of local heat using ultrasound or deep wave diathermy, or infrared. See, what I was onto something when I said radio frequency.
Mhm. It makes sense though, just from the
Mhm.
perspective of, increased circulation.
Ooh, shockwave. So let's see, measures to enhance proliferation of osteoblasts and pre-osteoblasts include the use of stem cells. This was back in 2013. Extracorporeal shockwave therapy, aspirin, some word I can't pronounce, bortezomib, whatever, melatonin, and the application of local heat. The use of VEGF would encourage proliferation, blah, blah, blah. Avoid NSAIDs and SSRIs. But yeah, so we already found everything in this article without even finding this article. I mean, we came up with all of the stuff in this article, and that was pretty much everything.
That's pretty cool.
Yeah. This one in rheumatology.
So now it's just a key of her finding somebody that does specifically treats that specific type of condition.
There is nobody. Oh, I think she's going to somebody in the medical center who probably, I guess we'll see what kind of thing he comes up. But I'm glad she's like looking at everything and going to everybody. Then she'll already know when if she ever does come to see me, I'll be like, oh, well, here's some natural stuff that I know they did not tell you, because why would they do that?
Yeah.
Everybody else wants to do something, because patients want immediate, results, and they want to do something. And I'm like, okay, my results will not be immediate. You should be doing them though.
Right.
Yeah, because there's a lot of oils that have been studied for osteoporosis, but not osteonecrosis.
Right. Well, again, like you said, there's not that many
cases.
enough cases to really do.
Which is, good enough. I mean, she has that too. So it's not like I'm going to treat them, terribly differently. I know already what's going to happen with osteoporosis. So I can make a little osteonecrosis ebook. And off you go. And then I'll have everybody in the world with osteonecrosis. And I will be the worldwide expert on osteonecrosis.
Well, the question is, are you going to treat it though? Are you going to?
Well, I mean, it would be an adjunct, because like I said, a lot of people have been to people and don't have anything, but I've got stem cells, I've got radio frequency, I've got, I got stuff.